Welcome. Have you ever felt like your ears were full of water, even when you haven't been swimming? You might be experiencing otitis media with effusion, also known as serous otitis media. In this video, we'll explore everything you need to know about this common ear condition, from its causes to its treatments. So, what causes this fluid buildup in the middle ear? Often, it's related to a dysfunction of the eustachian tube. This tube connects the middle ear to the back of the throat and helps equalize pressure and drain fluids. When the eustachian tube becomes blocked due to allergies, a cold, enlarged adenoids, or even changes in air pressure, fluid can accumulate in the middle ear space. In children, the eustachian tube is shorter and more horizontal, making them more susceptible to blockages. Let's delve into the pathophysiology. Normally, the eustachian tube opens and closes to maintain equal air pressure on both sides of the eardrum and to drain any fluid that accumulates in the middle ear. When the tube malfunctions, negative pressure builds up in the middle ear, drawing fluid from the surrounding tissues. This fluid, which can be thin and watery or thick and glue-like, then sits in the middle ear space, interfering with the eardrum's ability to vibrate and transmit sound. Otitis media with effusion is extremely common, especially in children. It's estimated that most children will experience at least one episode of OME before they start school. While it can occur at any age, it's most prevalent between 6 months and 2 years of age. Seasonal factors, such as increased incidence of colds and allergies during the fall and winter, can also contribute to its occurrence. The symptoms of otitis media with effusion can be subtle. Often, there's no pain, unlike acute ear infections. Common signs include a feeling of fullness or pressure in the ear, muffled hearing or difficulty hearing soft sounds, a popping or clicking sensation in the ear, and sometimes, balance problems. In children, you might notice them turning up the TV volume, not responding when called, or having difficulty understanding speech. Diagnosing otitis media with effusion typically involves a physical examination by a doctor. They'll use an otoscope, a special instrument with a light, to look into the ear canal and examine the eardrum. A pneumatic otoscope, which puffs a small amount of air against the eardrum, can help assess its mobility. If the eardrum doesn't move normally, it suggests fluid is present. Tympanometry, a test that measures the movement of the eardrum and pressure in the middle ear, is another common diagnostic tool. Audiometry, or a hearing test, may be performed to assess the degree of hearing loss. While there aren't strict types or classifications, OM can be described based on the duration of symptoms. Acute OM refers to a condition less than 3 months, while chronic OME persists for 3 months or longer. The fluid itself can also vary in consistency, ranging from thin and serous to thick and mucoid, sometimes referred to as glue ear. Treatment for otitis media with effusion often involves a wait-and-see approach, especially if symptoms are mild and hearing loss is minimal. The condition often resolves on its own as the eustachian tube function improves. Decongestants and antihistamines are sometimes used, although their effectiveness is debated. If OM persists for several months or causes significant hearing loss, other options may be considered. These include pressure equalization tubes, also known as P tubes or myringotomy tubes, which are small tubes surgically inserted into the eardrum to allow air to enter the middle ear and fluid to drain. Adenoidectomy, the surgical removal of the adenoids, may also be recommended, particularly in children with enlarged adenoids that are contributing to eustachian tube dysfunction. Preventing otitis media with effusion can be challenging, but there are some strategies that can help. Avoiding exposure to secondhand smoke is crucial as it irritates the eustachian tube. Ensuring children receive recommended vaccinations, particularly the pneumococcal vaccine and the flu vaccine, can also reduce the risk of ear infections. Breastfeeding infants for at least 6 months is believed to provide some protection against ear infections. Proper allergy management can also help prevent eustachian tube blockages. The prognosis for otitis media with effusion is generally good. In many cases, the condition resolves on its own within a few weeks or months. However, if left untreated, chronic OM can lead to hearing loss, speech and language delays in children, and, in rare cases, more serious complications. Recent research has focused on developing more effective strategies for managing OME, including the use of nasal steroids and the investigation of new medications to improve eustachian tube function. Ongoing research aims to provide better, less invasive treatment options for individuals affected by this common ear condition. Remember to consult with your doctor for personalized advice and treatment options.